With Agentforce Health, care coordinators get a 360-degree view of their members, demographics, contact info, care plans, and open care gaps. But for many members, that clinical picture is often incomplete due to disparate systems across providers, pharmacies, and lab systems. Claims can only provide a partial picture of what is needed for care management. Let's take a look at Charles Green, a new member of Makana Health. Charles Green has 4 open care gaps: high blood pressure, untreated diabetes, overdue for a high-risk medication review, and inadequate colorectal screening. All 4 are flagged open, and without clinical data to back them up, it's hard to know if Charles has actually received this care, or are these truly unaddressed gaps. With the HealthEx integration, care coordinators can request comprehensive clinical records directly from the member, right from within Agentforce for Healthcare. HealthEx empowers members to access and share their health records through TEFCA individual access services and FHIR-endpoint-based records retrieval flows, all with explicit individual consent. After enrollment to a care management program, one click sends Charles a secure invitation to share his records. Charles receives a notification from his health plan, asking him to share his health records through HealthEx. No app to download, just a link. Charles taps the link and lands on HealthEx. In just a few simple steps, Charles can give his care team the full clinical picture they need to better support him. Authentication with HealthEx is simple and offers several options. Once Charles is authenticated, he's asked to consent to share his records with his health plan. Consent is clear and explicit. Charles can see exactly what he's agreeing to and what he's not. And if he ever changes his mind, he can revoke access at any time. To make sure HealthEx finds the right records, Charles has the opportunity to verify his identity with a quick selfie. This is what allows HealthEx to automatically locate his health history across providers and systems. Within moments, HealthEx identifies and retrieves Charles's records from his connected health systems. His full clinical history, pulled together automatically. If there are providers HealthEx didn't find automatically, Charles can search for them and add them directly. This ensures his health plan gets the most complete picture possible. Charles confirms, and his records are encrypted and securely transmitted to his health plan. For Charles, it took a few minutes. For his care team, it changes everything. Back in Agentforce Health, the picture changes immediately. Charles's 360 now surfaces a complete clinical history, diagnoses, active medications, immunization records, recent lab results, and more, all sourced from HealthEx. Care gaps that were previously unresolvable are now closing automatically, backed by Charles's comprehensive health history. For any gap that remains open, the care coordinator launches the member's specific health risk assessment. And this is where HealthEx data really accelerates the workflow. Instead of a blank form, the assessment has suggested data from HealthEx. Diagnoses, medications, and relevant history are already surfaced via Agentforce Health as suggested answers. The coordinator just reviews and confirms. The assessment is completed in a fraction of the time, with greater accuracy and a fuller picture of Charles's health. Salesforce's integration with HealthEx connects health plans to the clinical data they need, sourced directly from members, with their consent, and delivered where care coordinators already work. With richer clinical context, Agentforce Health can drive better outcomes across care management, prior authorization, and quality programs, helping payers optimize operations while improving the member experience. Learn more today at healthex.io/demo.